Hey everybody, this is Dr. Ammitai Worob at Sea Change Family Chiropractic. It's Thursday at 1:30 p.m. Eastern Standard Time here in Ithaca, New York. If I didn't already say that. It's a nice sunny day today. We've just had like 5 or something days of rain, and we got another like 10 days coming up. But we have a short respite with a lot of sun today. And today we're talking about not such a sunny topic for some people, which is sciatica. And we're going to be talking about this today. We'll post some links down below. And if you have any questions, please post them. If you're live with us on Facebook, like I said, we're here live Facebook every Thursday at 1:30. If you haven't liked our page yet, please do that so that you can find out what each week's topic is and get a notification that we're going to be live so that you can participate in this conversation. And if you haven't subscribed to our YouTube video yet, do that as well. That way you'll get a notification. We upload the videos up to YouTube if that's your preferred viewing place for them. And so we get a lot of questions about sciatica. A lot of people will come in saying, I've got sciatica. And so we always start with the question, defining terms. So what is sciatica? So our sciatic nerve, actually, are we getting this back here? A little bit. Okay, well, we have a poster behind me. It's about a 70-year-old poster, and it's held up pretty well. And it shows the anatomy of the spine and the nervous system, the peripheral nervous system emanating from the central nervous system. Again, our brain is way up top, descends down through the spinal cord and out through the nerves of the spine. And the nerve roots that come out of our lower back give rise to the sciatic nerve. And the sciatic nerve controls both sensation and motor control in the lower leg, or in the leg, the posterior leg. So sciatic nerve comes from the nerve roots of our low back. That's usually the source of sciatica. And the sciatic nerve, again, controls how our body, or how the movement of the muscles in the back of our leg and bottom of our foot, as well as what we feel there as well. And so sciatica is really a condition where you're experiencing pain, tingling, numbness into the lower leg, typically, but it can start anywhere from the low back into the buttocks, down into the hamstrings, down to the level of your knee, can also go down into the calf muscles and all the way down to the bottom of your foot. It can be a range of anywhere from a dull ache to like a crampy feeling to the sensation of someone poured lighter fluid on your leg and lit it on fire. Also numbness, can have numbness in the bottom of the foot, can have numbness along the back of the leg. All these things fit under the category of sciatica. And it is really pretty exclusive to the back of the leg. The nerves that control the front of the leg, side of the leg, emanate from higher up in the lumbar spine, higher up in the low back. But really sciatica is coming from the lower nerve roots in our lumbar spine, giving rise to the sciatic nerve and causing, again, that numbness, pain, tingling into the back of the leg. Unfortunately, I have personal experience with this and have suffered sciatica at times in my life, more recently from an injury, and have run the course of all those things, from a deep ache in my low back to the muscles in the buttock muscles, the gluteal muscles cramping or being in spasm, to feeling like someone poured lighter fluid on my leg and lit it on fire, to numbness in the bottom of my foot. And what causes sciatica is really the next question. And that typically is going to be either one or a combination of having a disc herniation. And actually, that might be next week's topic, is let's talk about disc herniations, because when we talk about terminology, there's lots of different terms that are thrown around, like I have a slipped disc, I have a herniated disc, I have a protruded disc, I have a, I'm trying to think of some of the other kind of non-technical terms that don't really apply, but I hear a whole variety of things. So we'll talk about disc herniations next week on our Facebook Live video. So disc herniations can cause sciatica. That's where the disc, you know what, Siobhan, do you mind grabbing that, the big model of the lumbar spine with the red in between? Yeah. So I'll show you what that looks like and how it affects the nerve roots that go into the sciatic nerve and can cause sciatica. And so, let me know if you can see this. So this is lumbar spine here. We have our spinal cord. We have the nerves coming out. And so when we have a disc herniation, the ones that are going to cause sciatica tend to be like this, where there is nerve irritation because of either, disc irritation, either because of nerve irritation, because either the disc is pressing on the nerve or the chemicals that are, the disc material is highly irritating to nerve material. So it can be that the disc has material is extruded and now is bathing that nerve in highly irritable material, or it can be, such that the disc, is narrowing this space where the nerve comes out of, that foramen, and we can have arthritis, built up bone, making that hole smaller where the nerve runs out of. So those are typically the things that are going to cause sciatica the most. You can also have sciatica. Some people, like our sciatic nerve, runs through two muscles, piriformis and our glutes. And if we have piriformis syndrome, would be a compression of that sciatic nerve between two muscles. If our gluteal muscles are overworked, or in spasm, or chronic spasm, it can cause that compression too. Some people are unlucky enough to have the nerve run through muscle tissue, not just between two different muscles, but through a muscle itself. So every time you contract, it's compressing on that nerve. That is less often the case. It is typically coming from the low back, but it can also be coming from, again, basically your butt muscles. It can also, in certain cases, come from lower down, like in our hamstrings, but typically, most cases, it's going to come from the low back from either a combination of disc herniation and or arthritic change, and or spinal stenosis, where actually the canal that our spinal cord runs through, that is narrowed. So those are the most common causes of sciatica. And in terms of treatment, again, it depends on severity. It depends on the severity, it depends how long it's been going on, and it depends on the origin. But more, every year there's more and more journals and medical boards saying that the first line of treatment is chiropractic and physical therapy. Really what we're looking to do is assess what is causing it. And once we've determined what's caused it, it's going to be generally a combination of decompressing that nerve and elongating that nerve and normalizing the tissues around it, and then strengthening and stabilizing. So depending on which chiropractor you're seeing, depending on which physical therapist you're seeing, they may do everything all under one roof. Even though I do all the things we're talking about, I do some things better, and some physical therapists do some things better, and that's where we tend to work together to get the best results. When we've done that, sometimes it's simple and it's just a question of one intervention, like chiropractic adjustments. Sometimes it's one intervention of physical therapy exercises. Most of the times it's both. And like I said, there are some things where if it's in the leaning towards the chiropractic side of things where there's some physical therapy required, usually people get better just by coming to me. Where it's a little bit that progression needs to happen with physical therapy, or it both need to happen at the same time. That's where people get the best results working with both of us. And it's the same thing. Some people respond really well to physical therapy and may not need the chiropractic care to, as long as they're doing more things in that physical therapy office than maybe some typical are. They don't need to see a chiropractor and a physical therapist. But like I said, if it's more severe, if it's more chronic, tends that both are needed for maximum results. And that's really what we're looking for, is get better as quickly as possible for as long lasting as possible with a minimal intervention. Now, sometimes those interventions are not going to be enough. Sometimes the severity is too much, the chronicity is too much. Chiropractic and physical therapy can only get you so far, or if it's a more acute injury, there is a time and a place for neurosurgery, where they would come in and do any number of procedures. Sometimes they'll go in and remove that part of the disc that was compressing on the nerve. Sometimes that in and of itself will provide a huge relief. And then usually the course of, again, chiropractic care and or physical therapy will help post-surgery. That surgery tends to get good results when it's the right surgery. Sometimes, again, where it's more chronic, they'll pin down, they'll do a fusion surgery. The statistics on that are not as good. About 4 out of 5 surgeries of that particular surgery fail after 5 years. So that means, 1 out of 5 people is better after 5 years, 4 out of 5 are just as bad or worse, because now it's 5 years later and the problem is still there. And that's where, again, wherever surgery is indicated, people always get the best results when they're in the best shape possible going into surgery. So that's also an indicator for the reasoning of go to see a chiropractor and or physical therapist first, because if you do end up needing surgery, you'll get better results from having done the chiropractic and physical therapy first versus getting the surgery and then trying to clean up afterwards after things have been pinned down by either scar tissue or hardware. So in summation, sciatica, pain going down the back of the leg, usually caused by disc herniation and or arthritic change. And really what you need to know is to come see a chiropractor and or physical therapist that is going to take a broader approach than some chiropractors, than some physical therapists do, where you're going to integrate both the active and passive therapies to get the best results. And it's our job, it's my job in my office, if I don't get the results that we're looking for, to figure out why and who to refer to next. And sometimes that means the neurosurgeon, but again, we try to make that the last house on the block. Not that there's not a time and a place for it, and not that we're not grateful for the expertise that they have, but if we can avoid that, all the better. People get better results over a longer period of time. So if you have any questions, please post them. We'll post a couple links down below. Share this with people, because sciatica affects millions of people annually, and it can be not only uncomfortable, but debilitating in not just our work, but our ability to enjoy the things that we love to do with the people that we love. And if you haven't subscribed to our YouTube channel, go ahead and do that. You'll get this video and all future ones, as well as if you haven't liked us on Facebook, please do that so you can get notifications on next week's event and future ones. Next week, again, we'll be talking about disc herniations, which is a great tie-in with what we talked about today about sciatica. And I'm always looking to hear your suggestions, comments, questions, because that's what we're doing this for, is to provide information to you, whether you're a patient here in our office or not. If you're not a patient in our office, one thing that we do is put out a opportunity to come in at a reduced cost. We'll have that link in the comment section of this video. So if this was at all applicable or of interest to you or a family member, now would be a good time to take care of that, again, before things progress to where they're irreversible. And we'll look forward to seeing you next week here on Facebook Live.